I had taken to some brief conversations with osteopaths and chiropractors, and I had figured that there were some common conceptions between the two practices that I would like to point out. Although some of these concepts would be explored, they're not limited to the list here. A common concept that is pointed out by osteopaths and chiros is the causation for disease. In literature, osteopaths focus on the vascular circulation in the search for the cause for the disease, whereas the chiropractors tend to investigate, in literature, the neurosystem. But personally, it seems straightforward to me that the distortion of vascular flow and neurotransmission may be a factor to disease. I do not see how one might be able to isolate the vasculature from the neurosystem, as a functioning tissue or organ would require both nourishment and stimuli, hormones and neurotransmissions, in order to perform its specialized task. Physiologically, how can a tissue function with only one without the other? In a handout distributed by Tom Dummer in 1994 in the European School of Osteopathy, it notes that Little John has acknowledged the sympathetic nervous system as an intrinsic controlling mechanism on the overall circulatory function. As a result, both of these systems are intrinsically linked and perhaps unable to be independent from one another. On the contrary, a chiropractor, Mertz, published a paper in 2009 which contends whether or not spinal lesions or subluxations may interfere on neurotransmissions, as it found that it lacks significant evidence to fulfill the basic criteria for disease causation. However, the paper on its own does not suggest what the causation might be. It only suggests what the causation might not be. Furthermore, from my own personal experience, I have had my spine adjusted and definitely felt both relieving and aggravating factors or sensations throughout my body in that moment and later on in the day. Therefore, I am hedging onto the theory that spinal misalignment, coming from the form of somatic dysfunction, might have an will have an effect on my own bodily function. The second common conception is the difference between the two practices in terms of the range of techniques that the profession utilizes. Osteopathy is attributed to a more diverse range of techniques, including visceral manipulation, soft tissue, and cranial, whereas chiropractors are usually seen and attributed to spinal adjustments. However, further onto this presentation, this presentation would realize that this is not the case. In literature, it has been emphasized that what Palmer and Still came up with was an unoriginal idea, with the premise of joint manipulation arising from bone setting. Ron Berg's book notes that a difference between bone setters and osteopaths, and presumably chiropractors, is the amount of anatomical background and scientific justification within the field of work. Regardless, it admits that bone setters do result in positive outcomes for the patient. Bone setting in general is a physical practice in which displaced bones in relation to the joint are put back in place. Even by 1843, Riggs noted that bone setters have focused on the neurovascular supply of the body, from which the body might be affected by the displaced joint. It is emphasized that a small injury onto a nerve may inflict intense pain to the point of death. It is clear from his writings that the scientific basis for treatment at the point of time is still considerably limited, as his books constantly refers to the human being as God's creation, and with the explanation for the body's structure or lack thereof to God. It is interesting to note how the book deems techniques taught by people on people are inferior to those taught by the higher being. It stresses the need to connect with the body without the use of scientific and medical explanations for the treatment of the patient. In contrast, osteopathy and chiropractic in principle seeks to pursue scientific confirmation and affirmation for which the practice would be based on. This can be found in the next slide where the definitions of the profession by the founders are discussed. Yet both professions also seem to draw similarities from bone setting in regards to the identity of the non-physical entity, towards which osteopaths conceive as vitality or the spirit within the triune of the body, and which the chiropractors define as the innate and universal intelligence. It is commonly acknowledged that A.T. Still and Daniel David Palmer have lived near Kirksville in the late 19th century and have developed their respective practices within a short period of time of one another. The debate on whether the professions are derived from one another remains heated, and both of them struggle for greater authenticity. Osteopaths in literature claims that Palmer studied under Still and has gone on to develop chiropractic with his knowledge, whereas chiropractic books are adamant that Palmer has never studied under Still and that he had his own inspiration. Furthermore, it is pointed out that Still had a complete medical allopathic background and training, although Palmer did not during the foundation of their respective fields. Thus, I have gathered that there has been stronger criticism against Palmer compared to Still, as towards his lack of anatomical and physiological background. However, both Still and Palmer partook in magnetic healing, which may have strongly influenced the profession's development. And finally, in recent struggles and legal hurdles, osteopathy found recognition in the United States by the American Medical Association. After failing to establish itself as an independent healthcare system, it is now accepted and incorporated into the allopathic medical training. Thus, osteopaths graduating from these schools have the right to perform surgery and prescribe medication. This is in contrast to chiropractors who, in literature, have had a long-standing history against prescription and the traditional healthcare system. There have been several different interpretations of what the respective professions are by the words of the founder. Here is one of Still's definitions of osteopathy. Osteopathy is a science incorporating structure and function of the human mechanism, anatomy, physiology, and psychology, striving for equilibrium and health. I personally feel that this definition in essence urges the profession to take the mind and body of the patient very seriously, and to keep up with the medical profession in the understanding of the man. Palmer defined chiropractic as a philosophy, science, and art of all things natural, a system of adjusting the segments of the spinal column by hand only, for the correction of the cause of disease. This definition to me feels more academically holistic, in the way that it embraces its artful and more philosophical side, the theory, rather than potentially constricting within the factual confinements of science. It is also very clear about what would happen within the treatment room, and its stance against medication. One of the most significant differences for me is the strive for health and the correction of disease, terminologically. For me, health has a connotation of not being free of any disease, but to be in a state of well-being in which one is happy, in good function, and of healthy vitality. Where the treatment sees the patient as a person they are. However, the wording of treating a disease, dis-ease, seems to have a darker connotation to it, as to how the dis-ease is something to be rid of. Although dis-ease and disease are different in interpretation in their own right, it is possible that in some cases This ease is a natural progression of life, in which the body is attempting to adapt in the aging process. I personally feel that something as simple as headache or fever to hyperactivity or post-traumatic stress disorder is simply a protective mechanism of the physical, mental, and social issue, or from any social issue for the person. Thus, in order to eradicate this disease, may be to treat the symptoms and not the cause. I admit that there must be different interpretations to these definitions, and declaring my interest as an osteopathic student, I may be biased in some shape or form. The foundation principles in which the profession is created or born is important because that's where the origin of the practice is from. Henceforth, the foundation principles would be discussed here. Both chiropractic and osteopathy emphasizes the body's inherent ability to maintain health and the use of manipulation as a technique. But before I go on about the principles, chiropractors have 33 principles, of which I feel that I only understand a few from reading the books. I feel that the principles are more understood through application in practice. Henceforth, I feel that the comparison performed in this slide may be slightly or completely erroneous, depending on the accuracy of my interpretation of the chiropractic principles. In conjunction with the 33 principles, there are 3 core concepts that are emphasized by D.D. Palmer. Starting from the first principle of osteopathy, in which the body is a unit, it is usually followed on by the concept of the body, mind, and spirit, where the physical, mental, and non-physical, or metaphysical influential factors are taken into account in regards to the patient's current state of health. This seems to coincide nicely with Still's definition of osteopathy, where the science of the body and mind are considered in treatment of a patient. This is taken into context within the general osteopathic treatment, with the total lesion concept, when assessing the patient for any abnormalities, in particular the spine. In chiropractic, the principle for the triune of life, which is the unification of the 3 factors, namely intelligence, force, and matter. The unification of these factors is thought to be important in the maintenance of life. The individual function of these factors are quite complex and mind-boggling, as I personally felt myself like a dog chasing its own tail. In the chiropractic textbook by Stevenson, intelligence is thought to always be perfect, that nothing could ever go wrong. If it is thought that the intelligence has gone wrong, it is because of the limitations of the matter, which may be in form of a tissue cell. The conduction of the intelligence to matter follows the nervous system. It is written that the chiropractor's aim is not to stimulate the nervous system, but to remove the obstacle in order to restore normal transmission and communication between nerves, thus allowing the patient to heal on its own. This is similar to osteopathy's principle for the body's innate ability to self-defend and to self-heal. In chiropractic, the law of supply and demand describes the situation when a tissue cell requires additional material or immaterial force to which the afferent nerve supplying it senses. The stimulus transmitted informs the innate intelligence to which she supplies via other cells. If the supplying structure cannot function to meet the demands, it would result in a famine of force, leading to an incoordination of the whole. The innate intelligence within this law is vaguely described as a perfect controlling system that exists potentially independently, in every person. This is in contrast to the universal intelligence, which manifests within the physical, universal realm, and has no regards for the structure it governs, from the micro to the macro level. Henceforth, the innate intelligence is conveniently called constructive, whereas the universal intelligence destructive. This author has yet to come up with a complete understanding of this law and this principle. The law of supply and demand, in a roundabout way, may be related to the principle of structure and function in osteopathy. Rather than referring to an innate intelligence, if the structure is malformed or degenerate, it is then associated with the structure's inability to function optimally. Simply stating, on a macro level, if the cardiac muscles are pathologically hypertrophied, it would no longer circulate blood through its chambers efficiently. If the vertebrae along the spine is in lesion within a vector, it may not only affect its own range of movement, but the function of the structures surrounding it. On a micro level, if the satellite cells surrounding neural cells degenerate, it may affect the transmission of impulses. If an enzyme becomes inhibited by another molecular structure, it would no longer be able to perform its physiological function. It is interesting how both chiropractic and osteopathy realize that matter, or structure, can become limited and result in incoordination or affected function. The innate intelligence that is in chiropractic, I feel, may be brought together with the principle of osteopathy that there is a self-healing and inherent capacity to defend and repair the body. In osteopathic literature, it is described more scientifically with reference to physiological processes in which the body attempts to maintain homeostasis through and not limited to the endocrine and nervous system. On the contrary, chiropractic literature, the innate intelligence does not seem to be scientifically sound. But on the same point, I feel that there's a lot in science that has yet to explain in regards to the human body. On the final principle of osteopathy, the osteopathic treatment is based upon the three concepts above, where it is only stated in Palmer's three core concepts of chiropraxis, where the idea of treatment is observed. The concept for chiropraxis is as follows. There is a functional relationship between the spine and health, mediated through the nervous system. The next concept is subluxations adversely affect health. Thirdly, correction of subluxations by spinal manipulation improves or restores health. In regards to the profession's view of healthcare, Still's political platform contains 9 statements towards which osteopaths may abide to. Whether its relevance to stay politically correct with the occupation is unknown. I feel that a significant statement to draw attention to is Still's opposition to the use of drugs and vaccination, technology including electricity and X-ray, or other therapeutic approaches within the osteopathic practice. Even though Still embraces their approach, he still believes that the osteopathic toolkit is full enough that incorporating another practice technique would remove some of osteopathy from the practitioner's belt. It is similar how chiropractics have a almost identical view. It is stated that Palmer believes that the study of chiropractic is enough for a lifetime, even though it is one of many philosophies and science. The textbook encourages the practitioner to focus on the few philosophies that concern him or her most. However, it is to my opinion that how a profession would progress if one limits their study of work. I feel that if Sutherland kept to his limit of study, kept limiting his study, he would have never brought forth cranial osteopathy. Furthermore, I feel that osteopaths and chiropractors specialize with the working of the hand on treating the patient. The question that I ask is wherefore our profession should be on the lookout for techniques which best fit the patient, or whether we should analyze whether the patient best fits our technique. Because I feel if we stick within the limits of osteopathy that we were given during training, then I would never be able to pursue further techniques which may or knowledge that might further increase my understanding of the patient and of the health and of treating a lesion or dysfunction to maintain health. However, chiropractors in practice use X-ray for diagnosis. It is reported in literature that they use it to confirm their examination and palpatory findings for subluxated vertebrae. There are lots of skeptics regarding the frequent exposure of patients to radiation and its true benefit to diagnosing the patient. However, its use is advocated given the convenience to the practitioner to screen the patient on site without having to refer them for to a radiologist. The Western States Chiropractic College suggests that X-ray is useful if it is used in patients who had a history of trauma or presents with acute non-traumatic symptoms or prolonged chronic symptoms, or if they have scoliosis, congenital or tumorous disease, possible presence of foreign body, perhaps or even other abnormal clinical findings, including pathologically limited range of movement or unusual palpatory findings. I suppose the use of X-ray for chiropractors is to rule out any pathology that might present within the patient. However, I feel that chiropractors in their own right have the choice to use X-ray, and it neither limits or gives them an edge over osteopathy, as osteopaths can simply refer them to a radiologist and ask for an X-ray scan. I would feel that one of the main differences between the two professions are starting to blur, as osteopaths are also starting to use electrical diagnostic tools, including ultrasound, within their clinical practice. Osteopathy and chiropractic makes claim that that their own profession is both an art and science. Art because the practitioner has to be able to apply the theoretical and scientific knowledge in a practical setting, and has to be able to perform necessary palpation and manipulations with their hands in order to assess and treat the patient. The scientific aspect of both professions have been covered previously, but in order to mention it again, the practice utilizes knowledge gained by the objective and clinical observation within a methodical and rational system. The basis of diagnosis and treatment is upon the anatomical and physiological understanding of the practitioner. Both professions have made mention to holism in regards to the fact that the whole is greater than the sum of its parts. How this is adapted into the practice may be up for interpretation. However, from my understanding of osteopathy, if I was to acquaint this quotation with the human body, the cumulative function of the body, mind, and spirit is greater than if they were independent of one another. Similarly, the cumulative function of the neurovascular system, of the GI tract, gastrointestinal system, and everything else, the benefits of all of these systems working in conjunction is greater than if they were working independently. Taking this quotation into the triune of life in chiropraxis, it seems that this quote can be applied as well, where the intelligence, force, and matter must exist and harmoniously in order to express health. This is similar to the triune of life in osteopathy. I wonder whether or not these two principles can coexist together, whether not only we have the body, mind, and spirit, but there is also the intelligence, force, and matter. Potentially, due to the overlap of these concepts, it might not be possible. However, there are many other models which are similar. Stone, in The Science and Art of Osteopathy, writes about the communication model, which is composed of the physical, chemical, and emotional level of communication. Within these divisions are further subdivisions, and so on and so forth. The theory is that the breakdown of one of such divisions may lead to dysfunction. However, she emphasizes that these divisions are artificial and cannot exist in vivo. In a rather holistic manner, chiropractors are hoped to fulfill the following: that in manipulation, he does not forget the man. In pathology, he does not forget the patient. I feel that this is similar to the total lesion concept in osteopathy. Chiropractors also believe that a man is affected by every single stimulus acting upon him. As a result, spinal manipulation may have overreaching effects to the viscera and endocrine, and potentially the emotional and the mental health of the individual as well. I found it profound how chiropraxis humbly believes that men do not cure. It is that inherent power derived from the Creator that causes wounds to heal, or a part to be repaired. The Creator uses the chiropractor as a tool or facilitator. Chiropractic philosophy is truly the missing link between religion or power of various religions. It is very, to me, profound in the way that it believes that the man does not treat, that the practitioner does not treat, whereas the practitioner only helps the patient back to health, and that the work is solely due to the patient and perhaps the will of God. Similarly, osteopathy still has originated from an orthodox religious background, and he has kept with him the fundamental idea that man is the masterwork of God himself, and perhaps with a certain amount of arrogance, in my opinion, that osteopathy is God's law. Osteopathy is what keeps life in motion, as in knowledge bank and operative skill. Potentially, this may suggest that osteopathy is more than just a philosophy, diagnostic tool, or therapeutic approach. It may also be one's approach to life, way of living, and/or method of interaction. Regardless, both schools of thought in principle and theory are very high-reaching and holistic. Whether or not this is applied in practice may be a different story altogether. Generally, it is contested that osteopathy uses non-specific articulatory techniques in treatment to mobilize general fluid within the body. This can be seen within the context of the general osteopathic technique, where there is a system for articulating joints from the foot up to the body. This is contrasted to the chiropractic's emphasis on specific spinal adjustments, which is thought to release entrapped energy within the nervous system. This, however, Osteopaths have a specific adjusting technique as well, which is developed by Bradbury to focus on a minimalistic approach to correct the positional misalignment of the vertebrae or of any other bone in question in relation to the joint. The approach to thrusts may be considered as a difference between the two professions, where chiropractors and literature emphasize short lever techniques for their thrust. Osteopaths are attributed to their use of long lever. Other than personal preference, there does not seem to be any mention of the physiological differences between the two forms of thrust. It is of note, however, that the differences between the specific and nonspecific articulatory techniques may be historical, as in recent times, it seems, osteopaths may have their own preference on whether they employ a general or specific adjustment within the body. There are two main philosophies within the treatment approach to chiropraxis, largely generalized groups of practitioners: straight and mixers. Straight purists are practitioners who rely solely on spinal manipulations as their therapeutic tool. In an extremist neo-fundamentalist point of view, the following are departures from this purist concept, including clinical and physical diagnosis, hygiene and sanitation. On the contrary, mixers advocate for an increased range of healing methods within their scope, including and not limited to naturopathy, physiotherapy, hydrotherapy, exercise, myofascial release, and soft tissue. Personally, I feel that the straight philosophy is pretty self-limiting and dogmatic, where the practitioner is not allowed to diverge and explore potentially useful techniques to treat the patient. This seems similar to Still's political platform, where the incorporation of so-called foreign techniques are rejected. Yet the scope of the limitation is not as restrictive as that of the straight chiropractor. So I can see where a mixed chiropractor may potentially begin to diverge away from the chiropractic principles and philosophy, as the adoption of other techniques may water down their own chiropractic practice, causing an identity crisis, potentially. Vertebral subluxations are thought to be structural displacements from the norm, which may pressure onto the exiting nerve root, which may cause excess in molecular vibration, potentially resulting in local inflammation or global fever. This impingement is thought to not affect vitality, but affect the transmission of nervous impulse. B.J. Palmer strongly emphasizes that only atlas and axis may be subluxed. All other vertebrae are merely displaced, to which his father is noted to have called him a pseudo-developer of chiropractic, the man who changes his anatomy to best suit his philosophy. Even so, the distinction between a displaced and subluxed vertebrae has not been thoroughly explained by the chiropractic textbooks. Currently, a subluxed vertebrae is thought to be potentially affected by the kinesiology, neurology, myology, connective tissue, vascular, inflammatory, anatomic, physiologic, or biochemical factors. The vertebral subluxation may be comparable to an osteopathic lesion, which is also now known as the somatic dysfunction. These form along the spine and is explained to be a vertebral functional deviation from the norm, caused by trauma, sustained or recurrent mechanical stress, by disturbed visceral function, and or by psycho-emotional stress. The effect of this may lead to pain, abnormal sensation, or organic disease. These lesions may obstruct vascular supply, thus irritating nerve supply, and impairs the functional mobility of surrounding soft tissue, thus affecting their rhythmic activity and elasticity, thus reducing circulation and modified tissue tone, thus causing stagnation. There are many systems within the chiropractic treatment. One of the earlier ones includes Hole-in-One, where it focuses on the adjustment of a major subluxation in order to avoid over-adjusting the patient. Over time, This system evolved to focus on the upper cervicals, specifically atlanto-occipital and atlanto-axial subluxations. This theory is supported by the premise that a positive biomechanical outcome rippling through the entire body will follow upon the successful manipulation of the upper cervicals. The hole-in-one system contrasts with the Merrick, which is a diversified type full spine adjusting system. It is thought that certain joints of the spine are designated as guardians of certain organs, visceral areas, and body structures. Its aim is to stimulate or inhibit a visceral function, with it a map to correlate segmental dysfunction with systemic and visceral disorder. One may detect a subluxated vertebra by palpation, and using associated models, including one regarding somatovisceral reflex, to diagnose the patient. A book on hole-in-one claims that, from a biomechanical standpoint, Merrick manipulations are nonspecific and henceforth inept at restoring alignment integrity. At the same time, the Merrick system has been compared to a Bible, to which a kidney dysfunction must relate to a subluxation at thoracic 10 to 11. This system is similar to osteopathic centers, which is discussed in the next slide. There are many different approaches in osteopathy, including cranial, functional, structural. However, in this slide, I would instead focus on the systems of treatment approaches that one might take in osteopathy. This is to compare with that of chiropractic. Firstly, there's the general osteopathic treatment, which is also known as the total body adjustment. It is a general maximal treatment which aims to restore hemopoietic balance and aid the body's elimination of toxins. It is largely based on the common pelvic lesion, where it is thought that the liver causes the right pelvis to anteriorly rotate, causing a domino effect of lesions throughout the spine and down the lower extremities. This system may be used for both diagnosis and treatment, and is used to prepare the patient for a high-velocity thrust. An aspect of this system encompasses the osteopathic centers, whereas it is similar to the metric system of chiropractic. Neural reflexes are taken into account to reflect which areas of the spine the practitioner may be likely to focus on. The kidney center is thought to be located at T6 to L2. There seems to be a discrepancy between osteopathic centers and the Merrick system, to which further research into may prove fruitful for future diagnosis and treatment. On the contrary to GOT, specific adjustment technique is minimal, and as its name implies, specific. Its focus of adjustment focuses on a lesion on the spine or any joint that is found and is thrusted upon to regain balance. It is thought that the use of GOT after a specific adjustment technique may disrupt the body's ability to find its own normal. As a result, general articulatory techniques are utilized. It is quite interesting of note how similar chiropractic and osteopathy are in their systems of treatment, where the only difference is the basis of which the systems are based upon the philosophies. Henceforth, I feel that it is the history between the two practices that are different, but not the practice itself. It is interesting to note about the idea of life and osteopathy within osteopathy. The idea of life is movement. In this concept, if there is a joint that is immobile or is restricted, it tends to have less vitality, be less alive. That henceforth the idea of inducing movement into the area is to regenerate the area, to resuscitate life back into the tissue of restriction. Furthermore, the idea of osteopathy as communication, it is interesting how The practitioner and the patient relationship may be really important in the entire treatment process. If there's any sense of negative harboration of feelings or distrust, perhaps the treatment may not be as openly accepted by the patient as it could have been. Henceforth, the trust and the understanding between the patient and the practitioner may be exceptionally important. It is interesting, as of recent times, that chiropractors have started to adopt cranial osteopathy into their practice, just as final year osteopaths within the European School of Osteopathy are beginning to incorporate dry needling into their arsenal of techniques. And similar to the British School of Osteopathy and the British College of Osteopathic Medicine, where Swedish massage has now been part of their curriculum. Personally, I feel that individual practitioners are breaking free from potentially dogmatic principles that their forefathers may have intentionally or not placed on the practice to restrict their exploration of bodywork and healthcare. I personally feel that both professions have had a long history of chasing scientific affirmation to be recognized by the government and the general public. Perhaps instead of focusing on presenting its self-image, although admittedly it is pretty important for the survival of the profession. I feel that osteopathy in particular needs to realize that the goal of both itself and chiropraxis is to help support the patient that walks in through our practice, through our doors, and for us to support them and facilitate them through their moment of difficulty. Instead of trying to point out the deficiencies of the other practice, I believe that in order for both professions to thrive, it would be great if ideas, principles, philosophies, treatment protocols, and diagnostic tools were shared between the two in support of one another, so that practitioners may be able to learn from our differences. I feel that for one to be able to differentiate between the two professions, it is quite easy if one were to focus on a part of the whole. For example, the history or the principles that were laid down or the diagnostic tools that we use. But on the whole, I personally feel that the two professions are highly similar, nearly identical in the way that we wish to treat our patient holistically and a way of approach towards diagnosis. I feel that if one were to focus on the whole, it would be very difficult to differentiate between the two professions other than the fact that we have different names.